first keynote speech for this exciting evening. Our first speaker is currently a senior research fellow and director of the International Development Cooperation Research at the Korea Information Society Development Institute, which is called KISDI. His main research interests include ICT human resources development, national innovation systems, and telecommunication industry. He has published a range of topics, including on science and technology, human resources development in Korea, and R&D in Korea. Ladies and gentlemen, and all of you who follow us back home, it is my great pleasure to introduce to you Dr. Sangwon Ko. Please.
Thank you, ambassadors. Good evening. I'm Sangwon Ko, a senior research fellow at KISDI. And our institute mainly gives ICT policy consultation to the government. And it's a real pleasure and honor to discuss with distinguished guests and ambassadors on Nordic Talks. I'll focus my discussions today on the health-related aspect of Digital New Deal. I'll start with the Korean New Deal initiative, narrowing down to Digital New Deal and health-related aspect.
Why don't we continue sitting down, Dr. Ko? I think that's so you have some a nice place to we can enjoy your presentation.
Thank you.
I would also, in the meantime, just if you have questions for Dr. Sangwon Ko, please raise them on the Nordic Talks Korea website as the same page, the same web page as this is being streamed. From here, we will have one of our staff members bring out the questions in real life. So you will be able to actually pose questions to Dr. Ko and the other panelists as the evening moves along. Thank you very much.
Okay. The next page, please. The Korean New Deal initiative announced by the Korean government this July is the fiscal stimulus package combined with institutional improvement in response to the economic downturn, mainly caused by the COVID-19 pandemic crisis. As you may heard, crisis in English word is a two-syllable word, 위기 in Korean. The first syllable, 위, stands for danger. And the second syllable, 기, stands for opportunity. In the threat of pandemic crisis, the Korean government finds opportunities to restructure the economy and strengthen the social safety net. Korean New Deal initiative consists of Digital New Deal, Green New Deal, and stronger safety net. Next, please. The Korean government planned to inject 114.1 trillion won from the treasury until 2025 and expect these investments will create 1.9 million jobs. 45% of fiscal stimulus package will be invested in Digital New Deal project to create 9 million jobs. Next, please. The Digital New Deal identified 4 areas of fiscal investment. Those are on the PPT. The strengthening the DNA ecosystem, digitalizing the educational infrastructure, fostering the OnTech industries, and digitalizing social overhead capital. The most significant chunk of the investment went to DNA ecosystem, followed by digitalization of SOC. The health aspect are directly related to 2 areas of initiative, ecosystem and OnTech industry. Here you might wonder what DNA is. If you ask Koreans what DNA is, you will probably get 3 types of answers. The first one is the title of Korean boy band BTS's song. Their performance of this song at the American Music Awards 3 years ago is legendary among BTS's fans. Second, they will talk about Watson and Crick, the double helix, genomic sequences, etc. Third, some Koreans will speak about data, network, and AI. Korean technocrats are very good at giving an existing acronym different meanings. For example, ICBM is not an intercontinental ballistic missile, but IoT, cloud, big data, and 5G mobile, ICBM. So nowadays, next please. Nowadays, the buzzwords are DNA. Korea is well known for its fast network, but data and AI usage are relatively weak. It's partly due to regulation. Ironically, ride-hailing services like Uber and doctor-to-patient telemedicine is illegal in a country with the fastest network. The strengthening of the DNA ecosystem includes the following component related to health aspect. First, the collection and utilization of data in medical industries. That has been in doldrums so far because of strict regulation on data privacy. Some say that the contact tracing in Korea has been successful because of intrusive privacy protection law. But in fact, Korea's Personal Information Protection Act, which is somewhat equivalent to GDPR, is one of the strictest in the world and has been a significant hurdle for the development of digital health. The recent amendment of the law is the Korean government action to improve the situation. And a big data platform is a must for precision medicine and AI applications. According to PwC, a consultancy, 5G is a backbone of predictive, preventive, personalized, and participatory digital healthcare. And Korea can indeed leverage its 5G network for the development of digital healthcare industry. Next, please. So now turn to fostering the OnTech industry. By utilizing 5G and IoT, Korea will build 18 smart hospitals to allow real-time monitoring of inpatients and interdisciplinary diagnosis and treatment. Korea will also establish 1,000 specialized respiratory clinics for safer medical treatment in these times of COVID-19. And Korean version of IBM Watson, which is called Dr. Answer, which is also an acronym of which stands for AI, Network, Software, and ER, Answer, will be developed to precisely diagnose 8 diseases by 2022 and 20 diseases by 2025. Next, please. This diagram is an example of a smart hospital. There is no definition of what smart hospital is. So this is one kind of smart hospital. And this kind of smart hospital capable of real-time telemonitoring, analysis of electronic medical record, prediction of future conditions based on electronic medical record provided by other connected hospitals. You can see hospital A in the diagram. Next, please. The Korean government plan to provide digital healthcare services using IoT sensors and AI speakers to 120,000 elderly and others vulnerable to health implications. The Korean government also plans to offer wearable devices to 200,000 people with chronic conditions such as high blood pressure and diabetes in Digital New Deal. But currently, Korea has 8 million elderly people, that is age 65 and over, and which is the 15.5% of the whole population. And the number of elderly is estimated to shoot up to over 10 million by 2025. So 2 million more in the short span of 5 years. It's because of the baby boom generation. The elderly population is estimated to be 37% in 2045 in Korea, which makes Korea #1 in the world in terms of the percentage of elderly population. And as of 2018, around 11 million Koreans suffer from high blood pressure, and 4.4 million people from diabetes. So this pilot project is just to cover just a little of those elderly and people with chronic diseases. Hence, the healthcare for the elderly and patients with chronic disease is a critical issue, coming issue in Korea. And the law permitting doctor-to-patient telemedicine has been sitting in the parliament more than 20 years due to strong opposition from the doctors. Doctors oppose telemedicine on the ground that it does not fully address the issue of patient safety, accountability for medical mishaps, and the over-concentration of the patients at big hospitals in Seoul if telemedicine is practiced. And the last one is the issue that has no solution, because everybody will just go to the biggest hospital for the telemedicine. So this government should wage an uphill battle with doctors to introduce doctor-to-patient telemedicine. But it's not been successful for 20 years. But this time, we should wait and see after this pandemic crisis and the coming of OnTech economy. Next, please. So this is the major domestic players in digital healthcare market. The diagram shows major domestic players in the digital healthcare market. And we have ministries, we have major hospitals, and we have ICT service companies, mostly large conglomerates, subsidiary, and we have telcos, and we have research consortium, and we have some notable startups and government agencies and GRIs, the Government Research Institute. And anybody who wants to enter the Korean digital healthcare market need to compete and cooperate with this player. And this is the end of my presentation.
Thank you so much, Sangwon Ko. Shall we give him a hand for that?
Absolutely.
Even.